Hi, just want to say thank you so much for taking the time out today to learn about the important topic of asthma. And it's a disease that affects the quality of life for more than 23 million people in the United States, and which includes 6 million children. And so this is, we all know somebody with asthma and that struggles with getting to school, getting to work, being able to just live their life due to this disease. And so this is a great opportunity to share some practices that can help our friends and family members with asthma just become, have a better quality of life and just really manage their disease so that it doesn't impact them as negatively as it could. Just want to say hi, I'm Tanya Braunlowy. I'm from Wichita State University Environmental Finance Center. Leslie Kimball is also on the line, and she's from the Environmental Finance Center as well, and we'll be kind of facilitating this webinar today. If you have any questions as we go along, don't feel like you have to save them for the end and try to remember. Just type them in that chat box there. And as Kevin gives his presentation, type in your questions, and we'll keep track of them so that we can ask Kevin at the end of the webinar the questions that you pose. And our goal for this webinar series is to help healthcare workers, public health professionals, insurers, Medicaid folks, housing experts, and others to learn more about home-based asthma care so that we can move forward towards sustainable financing and sustainable care for asthma patients in our communities. Kevin Kennedy is our speaker for today. He is an environmental hygienist, and he is the managing director of the Center for Environmental Health at Children's Mercy Hospital and Clinics in Kansas City, Missouri. The center provides patient-based services, training, and education, and performs research on indoor environmental health. Mr. Kennedy has been involved in housing and school environmental health assessments for more than 10 years, and environmental science and industrial hygiene chemistry consulting for over 20 years. So this is your go-to person for all things indoor air, and I cannot wait for his presentation, so I'm just going to hand it off to him to get started. Kevin?
Hi, welcome. Can everybody hear me okay?
I can hear you well.
Wonderful. Well, thank you very much. Appreciate you inviting me to participate and present on this topic. You're right, this is a topic that I've been involved in for quite a while. Actually, just in environmental science in general for about 30 years, so I'm getting old. So I have also taught and trained people on this topic over the many, many years. We've had many hundreds, actually several thousand go through our classes across the country related to environmental assessments of homes, and then have had a particular focus on asthma and reducing environmental triggers. So what I tried to do for today was really focus on what kind of knowledge people need to have or should have, or that we would recommend they have in order to best help families in reducing environmental exposure to triggers for asthma. So that's what I'll focus on today. And then as part of this PowerPoint, I also included at the end some educational slides specifically about best actions that people can use as they look to improve homes and reduce exposure. I have no specific disclosures relevant to this presentation. So this is our environmental health program. This is our staff. We've been had a program since 2001. We've been going into homes since 1995. All of the people here have been with us, most of them for quite a while. We are unique in the nation, I believe, in that we have 5 environmental hygienists on staff. That's unique for a hospital to have that number of environmental hygienists whose specific charge is doing the assessment of buildings of different indoor environments, whether they're in homes, schools, or child cares. We have had a school program and work with local school districts for as long as we've had a home program for that 20-year period. So we've worked with a wide array of audiences and trained a lot of professionals in the best approach towards managing indoor environments. We've had our Healthy Home program that we call it our Healthy Home program since 2003. We have 3 basic programs. One is our Asthma Friendly Home program. One is our childhood lead poison prevention program. And then we have another program called the Healthy Home program that is specifically for complex medical, immunocompromised kids, kids with unique complicated health conditions or comorbid conditions. So those are our 3 focuses today. Of course, I'm focusing on asthma and the environmental issues related to asthma. So when we're talking about asthma, this is a chronic respiratory disease where a person is exposed to a contaminant, an irritant, an allergen, something in the air that they have unfortunately developed an immune response to, so that their immune system reacts and then overreacts to the point where they become inflamed, they have significant swelling, and it inhibits their ability to breathe out. So over time, if not addressed, if not focused on to properly treat and to eliminate or avoid exposure to those triggers, they are often referred to. You see a permanent altering of their airway. So the goal is to better manage their asthma, teach patients to better manage their asthma, and B, reduce those environmental exposures. And we'll talk about some of those strategies. So about 56% roughly across the United States have what is called atopic asthma, or basically allergic asthma. So that means that there are specific things they are allergic to, meaning they have an immune response, an allergic reaction when exposed to those things. So it's highly variable depending on the sensitivity of their allergies, how sensitized they are to a particular allergen. And that then has a cascading effect that causes their asthma, another chronic health condition, immune response, causes that to flare up and to cause that additional swelling and affects particular parts of the lung. So we know that this disease disproportionately affects African Americans, people of Hispanic descent. In particular, Puerto Ricans have a much higher genetic predisposition for asthma. It also affects communities of health disparity, of long-term exposure to poor conditions in housing, poor conditions in the environment. So there are particular areas of the country where you see much higher levels of asthma. Unfortunately, Kansas City is yet one of those, where in our urban core you have as much as 18% asthma among children, and for some as high as 25% in some of the school districts we work with for some schools. So a lot of people have allergies. About 20% of the population has some kind of environmental allergy. Just under 10% have asthma. So it's important to know what those different types of allergies are. These I show here are known as environmental allergies. So dust mite is very common in the United States for people to have an allergy to. You'll see pollen, about 25% of people are allergic to it. Molds, about 25% of people are allergic to it. Pets, about 25%. So those people who are allergic aren't necessarily all allergic to all of these. Different people are allergic to different combinations of these. And then if they're exposed to significant amounts of these allergens, whether in their home, school, or childcare, then it can cause significant problems for their asthma, make it very difficult to control and very difficult to manage. So we want to try to reduce that exposure. So as you work with families, it's important to know what the asthma guidelines are. So if you are looking to do this kind of work, it's important to understand, that there are 4 key components to effective asthma management from the national asthma guidelines that were actually developed. The last major update was in 2007, although there have been some subsequent updates since. But the major guidelines were published in 2007, and really they haven't changed that much as far as what's recommended. It is these key components of assessing and monitoring proper use of medication, that emphasis on proper, making sure you teach the right inhalation technique, teaching self-management education, but understanding the environmental factors and any comorbid condition is a key component. And for the first time in 2007, environmental factors had a much greater emphasis, and the research on that has been very clear, both up to that point in 2007 and afterwards. So in those guidelines, it puts much greater emphasis, and that has become even more true now, on reducing environmental exposure. It's exposure to those allergens, the inhalant allergens, to irritants. Some things, I mentioned atopic asthma, there is non-atopic asthma. So tobacco smoke, for example, is not an allergen, but it's a significant asthma trigger for a lot of folks. So there are both environmental allergens and asthma from that, atopic asthma, and then there's this non-atopic asthma. In either case, exposure leads to that irritation, to that reaction. So we want to reduce that exposure. And long-term management is about identifying what triggers are relevant for a given patient and then reducing exposure to those. And this process is fundamentally about a multifaceted, comprehensive, or multi-targeted approach, depending on what the allergen is. The research shows that single steps to reduce exposure just don't work very well. So, for example, for many years, mattress encasements and pillow encasements were given out by themselves by clinics or by hospitals as a intervention for dust mite exposure, to reduce dust mite exposure. But studies of that have shown that just giving out the mattress encasements alone was not enough, that you really needed to do this comprehensive approach. You needed to educate families about cleaning, about other what we call allergen reservoirs in bedrooms, in living rooms, in places where people with asthma spend a lot of time. And then moisture becomes an important thing to manage when we're talking about dust mites. The more you can reduce the available moisture, the less likely they are to grow and proliferate in an indoor environment. The guidelines put a focus, clear back in 2007, they put a focus on delivering education in homes. Multifaceted education delivered in the home, focused on self-management education, focused on environmental assessment, and identifying cost-effective interventions to ultimately reduce exposure in the home. And if you can reduce exposure, then you reduce the impact, you reduce the symptoms, that reduces the need for medication, that reduces the too often times that people end up going to an emergency room or getting admitted to the hospital, and that's ultimately our goal, to keep them out of the hospital. We know too that with asthma patients, and this is important for anyone who worked with asthma patients to know, that their past utilization of healthcare is a predictor of future utilization. And this is a study we did a number of years ago where we took population data from our hospital and we looked backwards from a given appointment at the hospital or appointment in a clinic, and looked at how many acute care visits, so that would be an ED visit, hospitalization, urgent care visit, after hours care visit, any of that class of visit where they need to see someone right away. If you compile those for all patients and look in the past 12 months and how predictive the number of those past visits is of the future, you see that, as this chart shows, the more acute care visits in the past, the greater the likelihood, the probability of a future acute care visit. So it's a good piece of data to help you identify patients that are likely to be coming back to the ED or likely to be readmitted. And you want to target those patients and break that cycle of high utilization. And part of the process is doing a home assessment, identifying and reducing exposure to those triggers. It turns out that for a lot of families in that same study, those that had fewer of the regular outpatient visits, which are recommended for asthma patients, that they visit their doctor regularly just to assess their management and how things are going. For a lot of the families who are regularly visiting outpatient, as we see here, they don't have a lot of the historic acute care visits. So that's what you're seeing here on this chart, is the number of acute care visits goes up as the number of outpatient visits has gone down. And it turns out that 80% of those acute care visits are coming from about 20% of the patients who aren't doing the regular outpatient visits. So it's partly a process of knowing and teaching families the importance of regular visits to their doctor, following whatever their management plan is that we'll talk about in a minute, in order to keep them from having an acute care visit, an acute exacerbation of their asthma. So a key component of that is that all asthma patients should have an asthma action plan. So as a person who works with asthma patients, it's important for you to know what an asthma action plan is. Not necessarily that you would be administering those, but to have some sense of what they are. And really good if you are a community health worker or a home health visitor, to have some working knowledge of what the different components of that asthma action plan are, that it is a guide on medical management. It is a guide for when their asthma is very serious and they need to be calling 911, if they may need to use rescue medicines. You want to have some knowledge of that and be able to talk to families in general, just to make sure they have an asthma action plan. The goal is every patient has some kind of asthma action plan. It's also important for practitioners who are helping families that have kids with asthma to have some sense of what the guidelines say about the disease management, that there is a process, a step up or step down process that's recommended for how they manage their asthma. So that's what's shown in this chart, is there's guidance for the patients and how much additional medication they should use, when they should use it. This is part of teaching them self-management, and that for people who do home visiting, you don't have to have a strong understanding of this, but it's really important to understand that this is part of the process, especially for children or patients with persistent asthma. They should have been instructed on a stepwise process, and then in that process, you're checking, do they understand and follow proper inhalation technique for the medicine. That's vital that they follow that technique, and a lot of patients aren't very good at breathing in the medicine right. There's a specific process to that. And then talking with them on a regular basis about the environment that they're exposed to and what they might be dealing with, whether at home or school or in a childcare setting. There's also a tool called the Asthma Control Test, which is a validated measure of the control of their asthma. Now, there are several validated tests like this. There's one from the American Academy of Pediatrics called the Asthma Children's Health Survey that's also quite good. But this particular ACT score or asthma control test is one that's used by hospitals, and it's recommended for use by hospitals, but also by many others, because it's a good, quick technique for knowing how well controlled their asthma is and whether it's poorly controlled or not. And this is one of those criteria for determining if a home visit would be of value. Also, for those who are going to provide home visits, it's very important that you get some kind of training or teach yourself about the healthy home principles. These were established through a collaboration between HUD, EPA, and CDC. They've been adopted by all federal agencies. There's an interagency task force on healthy homes. There was a Surgeon General's call for action on healthy homes that puts emphasis on these keep it principles. And really, most states and county extension and others have all adopted and follow the practice of looking at these different issues related to these keep it principles. The primary value to the keep it principles is it's a simple way of remembering about various issues in homes. So I can certainly be an expert about moisture and humidity and how that affects mold growth or dust mites. But when I'm talking to families, my goal is really just to give them basic information that they can try to follow on a daily basis. So if I tell them just keep it dry and ways to keep it dry, that I hope is enough just to get them to do that. And that can be enough of that particular keep it principle. And if they follow all of these, then they should have a healthy home, which is our goal. So this is another a way of showing this representation between the patient and their asthma and the symptoms they're experiencing and the agents that they're exposed to, the different allergens in particular or irritants, and where that exposure occurs and what parts of a home, the contaminants, the reservoirs we call them, where these allergens and contaminants and irritants can build up in a home. And then there are what we call facilitating factors, things that contribute the food, water, air temperature, humidity, the conditions in the home that when combined with the reservoirs will lead to a much higher numbers of the allergens, higher concentrations. And if there are higher concentrations, then that's what people are exposed to and ultimately leads to some kind of flare-up or can lead to the development of asthma in sensitized individuals. So they may be sensitized but have not had asthma symptoms, but because of chronic exposure to certain environmental factors, they can ultimately develop the disease. So this epidemiologic triangle, which is commonly used to explain disease in the public health world, is a good way of representing this relationship between the home reservoir and the exposure, how they affect asthma. I like to point this out to those of you that will do home visits. You should know the importance of your work, that a report provided by the American Academy of Pediatrics Council on Environmental Health showed in a nutshell that clean indoor air was as important as medications in controlling kids' asthma. As long as the interventions are matched to the allergy results, they saw specific reduction in asthma symptoms merely by matching the interventions to what those triggers are, and that it was as efficacious as a routine of medication. So if you can do the two together, the combination, why that's that much better. At the same time, the effect of reducing that exposure was long lasting. And if a family can maintain a healthy home over a long period of time, it has a long-term effect, multi-year effect on just a child's health and well-being and their good quality of life that comes from better asthma management. So when you're working with families, when you're trying to determine what issues or concerns they may have or that are going on in their home, it's important for home assessors to know how to collect an environmental history and know what kind of information to collect. So it's not just about the inside of their home, it's about the community around their home, it's about their proximity to highways, to busy streets, to dusty roads, to air pollution sources, the amount of air pollution, to potentially trees or other outdoor pollens they might be allergic to. It's important to know the age of the house, the design of the house, any renovation or construction on the house, and where people spend time in the house, what kind of routine activities they have. All of these things combine in helping better inform you, the assessor, the home visitor, as to how you will help them in trying ultimately to reduce exposure and improve their quality of life and their asthma health. Fortunately, there have been lots of good publications. There are these clinical guides. These are called clinical practice guidelines for environmental assessments for furry animals, rodents, roaches, and dust mites. Those were put out by the Joint Task Force of the American Academy of Allergy, Asthma, Immunology, and the American College of Asthma, Allergy, immunology. And then there was a follow-up of a combination of papers, a themed journal in 2016 that was about mold and all of the different aspects of mold, whether it's health effects, whether it's assessing the environment, or what the allergens were. All of these parameters provide specific guidance on what the health effects are, how to clinically assess the patient, and then what kind of education to offer, and what we know about what interventions work and what interventions don't have a lot of evidence to support them. So it turns out across the country, there's more and more activity on home assessments and interventions. There is training that I'll touch on going on across the country. Insurance is starting to reimburse. I'll touch on that a little bit. So having some kind of evidence-based clinical guidance becomes an important tool, and these tools, these practice parameters, are extremely valuable. So just to give you a couple of examples from those, so this is from the dust mite parameter. So it has specific questions that could be asked in the clinic for evaluating exposure, and then based on how people answer those questions, there are follow-up questions and specific recommendations that can be made even before going to the home. But it also represents information that you can gather to better understand what kind of potential exposures are going on. So it's part of that environmental history that you might collect. In the cockroach parameter, here is an example of an algorithm that a clinician can use to understand what kind of exposure might be occurring. And depending on the information that they gather when they ask about this process, they can use that information to understand whether a home assessment is recommended, what kind of interventions might be recommended, and what the long-term impact of that might be for that particular patient. So the guidance is out there. It's just a matter of finding it and using it. And from those, the series of papers on mold exposure and molds, there's a particular paper that's specifically guidance for clinicians on what kind of questions to ask to understand if there's potential risk of dampness and mold in homes. And then based on how they answer these questions, there's an additional set of questions to determine whether a home assessment would be recommended. So the evidence is out there, the guidance is out there. It's just a matter of finding it and putting it in practice in your work. So I already talked about the healthy home principles. Many of the programs across the country use a multi-visit model. So it isn't just about going to the home once. Some programs visit homes as many as 9 times. So the key is that the routine interaction with the patient and the family or caregiver has the goal of getting them to change behavior, getting them to change practice, and reinforcing that self-management education, reinforcing following the action plan, and reinforcing the results of the environmental assessment and the healthy home changes you want them to make in order to reduce exposure. So it sometimes takes multiple visits at the home to work with them, partly to build trust with the family, but really to help reduce potential exposure. When we go to homes, it's important to know that you aren't just going to a home, going inside, sitting on the couch, talking with a family, looking at their asthma action plan, and then leaving. A home visit for asthma is a comprehensive process. You really are and need to look around the home, around the outside, look around the inside, do a little bit of digging. It's great if the family will walk around with you. It's very important actually if they can, because it's an opportunity to talk about various issues and concerns. But even if they're unwilling, it's important for you as the assessor to do that walk around, both outside and inside. So looking at the image here, you see the photo on the right shows a house that has trees up close to the house. So those potentially could be a type of pollen that child might be allergic to. You see vegetation near the house that can promote pests living near the house and finding a way in over time. If they are not out in the open, they have a place to hide, then they are not afraid of spending time trying to chew their way into the house. Living anywhere near gravel or dusty roads, that could be a risk factor. So paying attention to these outside factors, along with the conditions of the outside of the house, the condition of the roof, the walls. And I should emphasize, you don't have to be an expert on these things. It's a limited assessment, but most people, when they observe things like this disconnected combustion exhaust for a furnace, you know that's a problem. There are many things that people can look at, like the condition of the outside of this house, that you know that there is some kind of damage or problem there. This lower right, the dryer, we know it should be connected. This inside of a furnace, this bottom photo, clearly they have not done any kind of servicing or maintenance of this unit, so it's really causing some kind of problem. So these are things that you can directly observe that are likely obvious without having to be an expert on heating and air conditioning systems, for example. These are then, as I said, the common allergens and triggers that we're focused on. We're looking specifically for evidence of those allergens, along with any kind of irritant particles or things inside the home. We're also looking at, and you should have some knowledge that combustion sources represent a significant health issue, not just for asthma, but in general. The combustion gases they produce, like carbon monoxide, can be deadly. So it's important that these are installed and operating properly. But the exhaust from these different combustion sources can also produce a lot of particles that are significant respiratory irritants. So it's important to make sure they use exhaust ventilation, that if there's an installed exhaust vent, that it is functioning properly. Again, you don't have to be an expert. You're just looking for obvious signs. And then when you see things like candles and incense, that might not be considered an obvious combustion source, but if they have a large number of candles or they burn a lot of incense, that's a significant respiratory irritant. If you're worried about exacerbation of asthma, that's certainly something you want to think about. And then there are a host of other things about how people occupy their homes that represent contaminant sources. And you really have to ask about those. You have to have some knowledge of those. So as a person who wants to be an assessor, it's important to have some knowledge about what are gas sources and fumes, the role of fragrance chemicals. Fragrances have not been generally tested for their health effects, and they can have significant health effects on people without them realizing it. People might smell something funny and think, oh no, it's mold, but actually it can be sewer gas because they have some dried traps. And there are components of sewer gas that can be a significant respiratory irritant and even explosive if not managed in a timely manner. And then there are a host of household chemicals and practices and products that people use that can be significant contributors to airborne contaminants that lead to flare-ups and asthma attacks. And our goal is to eliminate those flare-ups and attacks. When talking with families, it's important to be asking about their home maintenance practices and what kind of household products they use in that process. You want to have some more comprehensive understanding of how they occupy their home, what their routines are. You can't just ask if they vacuum. You really want them to describe the process. Ask them to demonstrate for you. Ask them to demonstrate how they take care of the kitchen. It's important to look for opportunities to educate and to advocate for best practices for using good, healthy home alternatives to reduce exposure. So, looking for a second at this room and think about what you've heard up to this point. So what are some of the potential environmental concerns, potential environmental triggers? What are the clues when you look at a space that there is likely a buildup of the allergens, the dust in a home, that when a child plays in this room or walks into this room, that the settled dust and particles and things can get disturbed and kicked up into the air where they might breathe those and then ultimately have an asthma flare-up, an asthma attack, and have a problem. which is amazing when you think about it, that a child can have a chronic respiratory disease where if they spend time in a improperly cleaned or maintained room, it can actually cause them significant health symptoms and actually even be fatal in some situations, which is so tragic. This is a preventable fatality, so it's important to have this knowledge, but it's amazing that that is the case today, that there is a disease where that can happen. So as we look around this room, we can see it isn't as clean as we'd like. There are lots of stuffed animals, lots of what we would call reservoirs for allergens to accumulate. So you've got a lot of upholstered surfaces. Those upholstered surfaces combined with moisture, you can have dust mites live and thrive in some of these areas. And again, it isn't just about their bed, it's about the whole room. It's about managing of moisture in the whole room. So it's understanding the condition of the carpet. It's understanding the condition of the bedding. So you as an assessor will look into rooms, and it's about what you see. It's about what you observe. What do I observe in this room? And what can I interpret? So for example, I observe over here in the corner of this photo, a fan blowing into the room. Well, that implies I can interpret that maybe there is extreme heat or cool conditions in this room, and they're wanting to use a fan to supplement and provide some airflow. So I want to know where the air vents are in rooms, and are they blocked or obstructed? Are they inhibited in some way so that you don't get good air circulation? Most homes have some kind of a forced air furnace, and that furnace has a filtration system. And if all the vents are blocked, then you're not actually allowing the air to be filtered and for good supply air to be sent back to the room. So I may observe things and interpret conditions that I want to ask questions that help me better understand the possibility of exposure, and then I can better educate about changes they can make to try to reduce exposure and improve the overall indoor environment. So here's another photo of a different room, but when you think about it, this room definitely looks different, and the house looks newer, and it looks like maybe a better quality or a newer home. But when you think about the potential triggers, they aren't that different. We have the same kind of allergen reservoirs. We have a carpet. We have curtains. We have the same risks. And if I have moisture in high amounts in a house like this, even though it looks cleaner, I still have the potential risk for the proliferation of dust mites, the proliferation of allergens. Or if this family has pets and the other family didn't, well, I've got an additional risk factor from those pets, and I need to know where those pets spend time. Do they spend time in bedrooms? Do they spend time outside? Where are they going? As a home assessor, it's important for you to know the incredible value and importance of in-home education. And I don't mean in-home education specifically about healthy homes, but it's that in-home education about asthma management. It's reinforcing what a family has been taught or advised or learned about in the clinic or in, sadly, maybe in the ED. We need to extend the practice of self-management education and verifying they understand how to manage their disease. We need to verify that in the home and look at how they spend their time in the home, where they organize and manage their medications, where they have their resources like some of these educational materials that they may need to revisit on a regular basis to remind them to develop good practices and skills in managing the disease. So that becomes very important. Many programs, as part of their multifaceted process, provide lots of different kinds of cleaning supplies and recipes using greener alternatives, safer alternatives, and those have been shown to be as effective, if not more effective, than some of the standard commercial products. And they don't have some of those fragrance chemicals and some of the other things that can be a problem. So it's important to have a knowledge of what are some of the better cleaning products out there, and there are a whole wide array of published materials from a bunch of programs. So you don't have to reinvent this yourself. You can find lots of good information, and we certainly have some that we are happy to share and have shared for many, many years. So our goal then with the home assessment that you as an assessor should be aware of is our goal is to help them identify best practices, interventions in their home that ultimately lead to a reduction of exposure so you can improve their symptoms, improve their quality of life. The more you can teach, the more you can guide about trigger reduction, and maybe the more you can connect them to resources to help with the reduction of those exposures. This would be interventions in the home. Then the better their chance of improving their health, reducing the visits to the ED, and improving their overall quality of life. So the interventions are well known. The intervention strategies have been evaluated. There are best practices for how to tailor those interventions. So this is a chapter specifically from HUD's Healthy Home Program Guidance Manual, an excellent guide for those developing a home visit program or a healthy home program. It has lots of really good information specifically about assessment, about intervention, about program evaluation. It has a whole host of good chapters about program guidance that I highly recommend people read. In that guidance, in that chapter, there's a whole section then on common home interventions and some of those that are specific to allergen reduction in order to improve asthma management. And we can see that it doesn't cost a lot. These are not expensive interventions. Sometimes there are fixes to a home that can be expensive, but part of that is just general health and safety of the home. But for many of the interventions that are specific to reducing triggers, they are not, they don't have to be real expensive. Remember, you're also targeting and tailoring the interventions for the specific needs of a particular family, a particular patient. So there's a healthy home assessment component. That assessment develops healthy home actions. Those often are related to healthy home supplies that are provided. The value of healthy home supplies, if somebody lives in rental property, they can take the healthy home supplies to other apartments, to other rental property, take it with them. If they happen to own the home or you have a cooperative landlord, then you can do specific home repairs or home interventions, changes to the physical setup of the house. In this case, removing carpet, changing how the room is organized to reduce the potential for allergen reservoirs and allergen triggers to be in place. So it's a multifaceted, multi-targeted process that starts with your home visit and identifying actions to recommend, and then the supplies and interventions to go with that. Just to give you a quick overview of things we've seen over the years of going into hundreds, potentially thousands of homes related to asthma. So about 2/3 of homes we have visited have moisture problems somewhere in the home, mostly related to those places where you find moisture, kitchens, bathrooms, and basements. But a lot of homes, these are homes of families that have kids with asthma. A lot of homes had moisture issues. We also found a lot of homes had poor ventilation. Over half of the vents that I had mentioned were blocked, so you couldn't get actual good airflow into the house. And in a quarter of those cases, the airflow itself, because the system wasn't maintained properly, the airflow itself was very low and poor. So the combination of excess moisture and poor ventilation leads to chronic dampness, which then leads to excess microbial things like mold and bacteria and proliferation of dust mites. And speaking of dust mites, we found we do in our work do collect samples and test them for allergens and have done some research and published in the area quite a bit. We find 83% of children's bedrooms that were tested had dust mites in the bed. 60% of their family vacuums had dust mites. Even 1/3 of furnace filters, we find it's less likely to find it on the furnace filter because the particles from dust mites are larger and tend not to stay in the air very long, but you do find the dust mite throughout the house. In homes that had cats, we find a lot of families don't have cats because of potential allergies, but if they do, when they do have them, you can see again, you're finding the allergen throughout the home. So it could be very difficult to manage and keep allergen levels down. 2/3 of children's bedrooms had cat allergen detected in the dust. For dogs, homes that had dogs, we found the same issue as you might expect. You had allergen throughout the house and on the vacuum and on the furnace filters. Homes that had reported mice, there again, we found the mouse allergen throughout the house and in all places. So that's why we have to have a comprehensive, multi-component assessment and intervention process, trying to reduce exposure throughout the whole home. Roaches, same thing. Just as I said before, we find the allergen throughout the house. Finally, I want to point out that just because you provided that education and about environmental control doesn't mean that people always do things. Here we did a review of a couple of papers that specifically asked people about their likelihood of doing what they're asked to do, and they found that it was highly variable. Some people were willing to do specific things, like when they were dealing with pests, they were sort of willing to deal with the pests. When it came to moisture and mold, people were much less likely. When it came to using a dehumidifier, people were much more likely to use it. When it came to doing specific things like avoiding having pets or increasing or reducing the use of certain kinds of chemicals, people were not willing to do it. So we saw a lot of variability, and it's important to ask people and check in with them on the interventions to see if they're doing what you've asked. Because at the same time, it's not just about their asthma management and environmental factors. You're dealing with many families. You're dealing with complex comorbid conditions. You're dealing with disparities in the community. And ultimately, an asthma program has a goal of trying to improve the community's health and not just an individual, but really it is about the kids and improving their health and about their lives and their quality of life. Just a couple of things to be aware of if you're interested in doing this work. Then if you're in Missouri, Missouri has approved certain credentials for providing home assessments. There are 2 national credentials, the NEHA Healthy Home Specialist credential, which is actually no longer available, but if you have it, you qualify if you already have that credential. And then there's the Building Performance Institute Healthy Home Evaluator credential that is also qualified. And then there's a state qualification. As part of that process, these are some of the healthy home principles that are taught in some of the courses. So these are the kind of things that you'll learn in going through a class. So key components. This is that Healthy Home Evaluator credential. You can get more information from the Building Performance Institute. This shows you who the target audience was and who's eligible to sit for this particular credential. You'll have access to these slides after today. And then there is a state certification through the state of Missouri. So academic institutions in the state can sign up to provide a healthy home training program and teach people to be in-home assessors. Right now, there's one program in the state at Southeast Missouri University. Dr. John Kramer down there offers that state certification. So if you're interested in that, you can find that information online. And then we at Children's Mercy are a regional training center, healthy home training center. So we teach all of these courses and have had, as I said, in some cases, thousands of people, in some cases, hundreds of people take all of these different kinds of courses related to both general healthy home issues and then how to assess homes. If you want the current information on Medicaid reimbursement for healthy home services, this is the best place to go. It's the National Center for Healthy Housing maintains this site that you can roll over each individual state or click on it, and it will tell you specifically what the status is of getting reimbursement in place in any state across the country. So I highly recommend checking out that website. They have a whole bunch of excellent resources actually at the National Center for Healthy Housing on asthma, on healthy homes, and on reimbursement. So that is everything I have to cover. I want to point out that on the rest of this PowerPoint, there are additional slides showing all sorts of actions related to the different Keep It principles. That's part of the handout that you can have that's available through the Wichita State Environmental Finance that's available for this presentation. Thank you.
Awesome. Thank you so much, Kevin. I learned a lot. I took a whole page of notes while you were talking. If anyone has any questions, feel free to throw them into the chat box there. We're not going to unmute anyone to ask live, questions, because then the audio gets all weird. But we've got about 10 minutes to pick Kevin's brain. So I'm going to ask him a couple questions if no one types in any of their own. And we do have a couple of just questions we want to ask the group at the end, just polling questions that we'll throw up there. But let's dive in and ask Kevin a couple first. My first question is, what do you see as the biggest barrier in this in-home asthma care, getting a program of in-home asthma care going or whatever, from maybe the healthcare side, like from a doctor's office perspective? Like, what are those barriers in between the doctor's office and the in-home asthma care providers?
Well, one of the biggest challenges for physicians is as first finding a program, because there aren't as many programs as we would like there to be, because, for example, for Medicaid patients, the Center for Medicaid Services has changed the rules that states get paid through. It's called the Essential Benefit Rule, to allow states to set up in-home environmental assessment intervention programs. So it's up to states to get that set up. But then on the private insurance side, a lot of private insurance companies have not set up a mechanism for reimbursement. So that has been a hindrance, having some kind of payment process that pays for it. The research evidence is very clear that this is something that should be paid for, but the system hasn't been set up. And then for some clinicians, they're still focused on clinical practice, and their world is within the clinic. And the reality is, with diseases like asthma, the clinic and the hospital, the physician, the nurse, they play one role. The disease requires a sort of a comprehensive management process that includes, obviously, patient and caregiver, but includes them thinking about their home, thinking about the school, maybe involving the school nurse. The school nurse is a vital connection for both the clinic and the family in comprehensive asthma management. So anything we can do to improve that communication, but the clinicians, many of them are still sort of staying within their comfort zone, which is with what happens in their clinic. And then the other part of it is having, there are lots of people who know buildings and who know homes and can do effective home assessments, a lot of those Building Performance Institute accredited people, but they are not comfortable talking to people about health issues. So we need to do a better job of improving the collaborations and the partnerships between different community organizations to provide comprehensive home visits.
Excellent. So thinking about the home visits you've been on and you've done, you talked about how it's not just sitting on the couch and chatting, and but it's really, going into the nooks and crannies, looking in, under sinks and down in utility rooms. What is your favorite tool to use and to take with you on home visits?
That's a great question. I wouldn't say it's a favorite tool. I would say there are some basic tools that are really important. So probably one of the most important is a flashlight. So you can see well in dark hidden areas. Then a camera is of value, and I don't mean a camera on a phone. That's problematic to use your personal device for collecting photos. And there are a lot of features about some cameras that make it a more effective tool for collecting and documenting information. So a camera is a vital piece. We recommend that all, and teach in our classes and have agreed with others across the nation that there are 5 essential tools that all home assessors should have some knowledge of and be able to use, or at least understand how they're used. And those 5 tools would be valuable. So that's a combustible gas meter, that's a carbon monoxide detector, that's a moisture meter, there's an airflow indicator, and then some kind of temperature humidity gauge. So the temperature humidity becomes really important for thinking about different asthma triggers. We like to give families a thermohygrometer, it's called, a temperature humidity gauge, so that they themselves can monitor and track the temperature and humidity of various parts of their house and see what the level of moisture problems are. So those are the sort of the basic tools that we think all assessors should be have access to or have some knowledge of.
Great. All right. I'm going to keep going if no one's going to type in the box. And you talked about matching triggers to interventions, you know, really finding that it has a really big effect. What would you say is the most often seen trigger and intervention that works, you know, just like what's the one that you see the most often?
Yeah. Well, the key is you're trying to tailor the assessment interventions to what are the known environmental triggers for that particular patient. So first of all, having a good relationship with the provider so you can get good information from them, that's going to be important. They can tell you what their allergies are if they've been tested. They can tell you what the family may have reported in the clinic. So you have to have some kind of good relationship with them, and maybe a HIPAA relationship that allows you to have that information or collect some of that personal information. But that becomes important in understanding how you can help a family. And then knowing that, you'll know what their particular allergies are, then you can have a better understanding of what potential environmental risks you might be looking for. So if I know they have a dust mite allergy, then I'm looking for in the home those things that are known to promote the proliferation of dust mites. So I'd be looking at moisture, I'd be looking at how dusty the house is, do they have a vacuum? So I would be thinking about what the particular trigger is that has been reported, and then looking for things in the home that might be related to that trigger, both as far as what I assess for, and then what recommendations I'm going to make in order to minimize or eliminate that trigger. In general, the 2 most common things we see, again, is moisture plays a role in so many of these different allergens. So it's really an important thing that they are effectively managing moisture. And there's lots of research to show living in chronically damp conditions has all sorts of health effects associated with it, and actually has been shown to be associated with the development of asthma itself. So dampness becomes a huge issue. And then ventilation would then be the second one. What is the amount of airflow, the quality of airflow? That affects how dust and allergens are distributed around a house, and anything that allows that to build up, that's going to be something we're looking at as well.
And I had someone ask a follow-up. Can you go over those 5 essential tools? Again, it was for sure, not one of the 5, but we need a good flashlight and a camera. And then the official 5 were?
A combustible gas meter. So this would be to measure and assess for gas leaks. Now you're thinking, well, wait a minute, this is about asthma. Well, Healthy Homes is a comprehensive, holistic approach to health and safety in housing. So even though we may be at a home about asthma, we're also mindful of potential safety concerns. So it's an opportunity to educate and advocate for keeping everybody in the house safe as well. So we recommend all assessors, and we teach both basic assessment, advanced assessment. And for the basic assessment, we include the combustible gas meter, gas leaks, carbon monoxide detector. So that would be carbon monoxide from combustion sources, gas stoves, gas furnaces, gas water heaters, portable gas heaters, any kind of natural gas burning source. Carbon monoxide can be produced and is a poisonous gas, very dangerous. And at low levels, it can be a chronic health risk or concern. It is not specifically a respiratory irritant, but it is a poisonous gas. Then a moisture meter is a device that specifically allows you to place it on the surface of a wall or really anywhere, a cabinet, a floor, and it will give you an approximate amount of moisture content. So you're looking to see if a wall or an area is wet, saturated, or damp, and then you can check different parts of the house to see if there is evidence of a water problem or water damage other than what you can see just from direct observation. There are often hidden clues, and the moisture meter can be a valuable tool for that. An airflow indicator, it generates a smoke-like vapor. This is a fairly low-cost producer of vapor, and you can use it in a home to puff that vapor and make sure vents are exhausting properly. You can use it to see if, say, a gas water heater is venting properly. You can use it to check air direction. Is it coming in of a space or out of a space? Is the space under positive or negative pressure? So that can be valuable. And then there are several thermal hygrometers. They are devices that measure both temperature and relative humidity. And because they can measure both of those, there are certain mathematical formulas that can be built into that you can then understand the dew point and other different moisture-related risks in a home. So that becomes a valuable tool. We also really advocate that families have their own temperature humidity gauge. The good ones on the market have a memory storage, so they'll store the highest and lowest value they've collected in the last 24 hours. So you can move it around the house and kind of get a sense of where you might have damp areas of the house, so that you know where maybe to put a dehumidifier if that's an intervention that might be recommended. So those are the 5 tools and how we might use them.
Awesome, thank you. And we had one more question. Does Children's Mercy have community partners that they can make referrals to help clients with some of the identified issues in the home, like addressing moisture issues or other home repairs?
Yep, we sure do, and we have had for a long time. And that's a great question, an important one, because we're just one of many groups that might do the home assessments, but you really have to engage and work with the community partners that have funds and programs to make repairs to homes. So there are a wide array of neighborhood programs, of housing programs, and also community action programs. Many of them are related to a municipality or to a county or state. So it could be a community development program that the city or state runs that people have to apply to. So there's usually income guidelines. Many neighborhood associations and housing organizations have community development block grant funds from HUD that are given out every year, and they use those funds to support small home repair and emergency home repair programs. And then through the Health and Human Services Department, federal department, there are funds provided every year to each state that's usually distributed to a multi-county region through a network. It's called the Community Action Network. So different parts of Kansas and Missouri have a community action agency that serves that region, and they typically do weatherization programs. And now, in the last few years, many of those programs have put much greater emphasis on health and safety, and they do offer a wide array of services to support and help families. And then there are foundations and nonprofit organizations that have funds. Habitat for Humanity is a great example locally here in Kansas City region that has a program that isn't just looking at building new homes, but helps lots and lots of families with renovations and updates and upgrades to their existing homes. So there's a wide array that we have the good fortune to partner with and collaborate with, and that's not just true for us, that can be true in many other regions of the country.
Great. All right. Well, Leslie, I'm going to let you pull up the polling questions. If you just we have 2 questions. They're going to be really fast. Just stick with us. The first question, Leslie, I'll let you read them.
Yeah, so you should be viewing the questions now. So if you just want to real quickly read through those and answer. So the first question, which answer best describes the industry you currently work in? So you can select all that apply to you there. And then our second question, we just want to know during today's webinar what you learned. So there's a few options there as well. If you're joining us on a computer, you can vote real quickly. And we'll just keep this open for a few more seconds to let some more votes roll in.
Well, while you're waiting, I'm happy if anybody wants to follow up with me, they can certainly do that anytime. The email is there and phone number, and I'm happy to talk to anyone.
Yes, and we will we'll send a follow-up email from this webinar today, and we will provide the notes that Kevin referenced with all the extra stuff at the end, all the extra educational information at the end. And then we'll also have a link to that reimbursement map that he posted from the National Healthy Homes folks. So you can have just a link straight to that from the email we send you, and you can dive in to see what opportunities are available in your state. And then our plan is to keep doing these webinars for a few more months. And really dive into that sustainable financing for these programs question, and then looking at how maybe some communities are using partnerships between those home and housing programs, or the housing community, and maybe like landlord issues, because I know that brings up a whole crop of whose responsibility is it to make these repairs.
That's exactly right.
How communities are working with those institutions and combining those with the healthcare aspect, and then also diving more into that sustainable financing piece, so we can get the insurers and Medicaid and Medicare to help us pay for these sorts of things, because they really do have a big impact on health. So we want to make sure these keep going.
All right, I think we've got all of our poll answers in, so I think that's it for today. Any last comments, Tanya?
No, I'm good. Just thank you all for coming, and we'll let you know about our next one, hopefully in October. Thank you, Kevin.
Thank you very much. Appreciate it.
Thank you, everyone. Bye-bye.